My name's Jo Watson. I'm one of the skin cancer nurses that works here in Bristol. I work with the plastic surgeons and the dermatologists here, and I am part of a team of 4 skin cancer nurses in Bristol, so I've been very lucky to be able to come here, particularly because I haven't had to travel very far. I know a lot of you have come a long distance. So I work in a big unit, not as big as some of the others we've heard about, but I just want to give you a little bit of information about a package that we offer here that's certainly not unique to Bristol, but we're one of the pilot sites. We're looking at recovery and improving levels of fitness, for example, post-diagnosis of melanoma. So as we've heard already today, the story about cancer is changing. Cancer in general, plus particularly malignant melanoma. I've been doing this job for about 15 years. So 15 years, and we've had very little in terms of breakthrough, in terms of treatment options. Suddenly, in the last 2 or 3 years, there's been some amazing breakthroughs. On almost every presentation I go to and listen to, there's been something else that happens. There's more and more drug therapies that are out there. But what I want to do is sort of take you back to actually when you were first diagnosed and you first received the information about melanoma, and looking at what you can do, because potentially, you guys are living longer than patients 10, 15 years ago. You are living with melanoma. You're living, you're coexisting with it. So what we want to do in the good old days, or bad old days when I first started, we used to see people very quickly for a 10-minute consultation. We told them what we were going to do, we did it, and then we wouldn't see them for months, 3 or 4 months on end. Now, we expect, and of course we should be delivering much better than that. People are living with it, so what can we do to improve your recovery initially after your diagnosis and your treatment, but also moving on long term? So 2.5 million patients, already heard, now are living with cancer. I must say quickly that I work as a nurse, a clinical nurse specialist in a hospital. I'm paid for and employed by a hospital here in Bristol, but I'm sponsored by Macmillan. So Macmillan don't pay my wages, but they do give me £1,000 a year kind of to do educational stuff and provide training and go off and do bits and courses. So part of the talk I'm using today is sort of with Macmillan's permission. So why do we as health professionals need to make changes? So as I've already discussed quickly earlier, there are now great improvements in terms of early diagnosis and early detection. So people are a bit more aware. I don't know about you, but within Bristol we often get people who say there's been something on Holby City or Corrie or EastEnders. So our numbers of patients who get referred goes up as it gets in the media. Particularly, this time of year, people are exposing their skin and going out in the sun. Again, our rates of melanoma diagnosis increases in the summer. That doesn't mean to say that diagnosis definitely goes up. It's just easier to recognise. People are being detected with melanoma early. There's more advanced treatments, like we've heard about earlier today. People are moving from acute to long term. So presentations 5 years ago, patients potentially with stage 4 disease generally didn't live more than a year. We're now seeing lots of studies where patients are living 10 years and people are talking about a cure. Those things weren't around when I first started. So people are living with melanoma. And lots of people are living with and beyond it. But not everyone is living well. So again, it's all very well saying, dear patient, we've treated you, now go off and go back to normal. But actually, looking at the studies, 37% of patients with cancer were more likely to be unemployed than the general population. And more than 1 in 5 were suffering with loneliness, again, because of their diagnosis. Patients will often say to me, I've only had melanoma. It's not a proper cancer, is it? It's only melanoma. It can't be proper because I haven't had chemo, so I'm not entitled to this. I shouldn't expect to feel this way. I don't understand why I feel the way I do, but we all know actually melanoma is cancer. It's okay. So something that Macmillan developed, and Bristol was one of the pilot sites, was looking at something called the recovery package. So I won't explain this slide too much, but it'll be in the slides later, but essentially the recovery package is all about looking at patients and their families as a whole rather than just looking at the diagnosis. So it's looking at providing information about complementary therapies, about a written summary about your diagnosis that goes to you and your GP, copies of your pathology results, information that goes to your GP, looking at care planning, looking at the whole package. So diligently every year we send or give out questionnaires to patients and their families about how they've felt their treatment has gone so far, and we either get written responses or we get electronic responses, but time and again the issues that come up for the patients that I see are often the same things. So these are, these aren't these are not rocket science in terms of what they're reporting. So issues, consequences of treatment. So you remember, these aren't patients who've had chemotherapy necessarily. These aren't patients who've suffered months of treatment. They may have only had a very minor procedure surgically as a local anaesthetic, but problems that still the least: worry, fear and anxiety, sleep problems, which is different to tiredness and fatigue. They are different areas, issues with appearance, and issues about how to talk to other people, how to go back to your family, how to explain to your children, how to explain to your mother, how to explain to your work colleagues. What do you do? How can you explain things? So again, we're not unique, but we're one of the pilot areas in the country here in Bristol about rolling out living well. So what is living well? Living well for us here, again, we've run ad hoc sort of coffee mornings back in the good old days or bad old days when patients used to go in for surgery in the plastic surgery wards. I would visit them on the ward on a daily basis. They would be in for 3 weeks. They would have had a very minor skin graft or possibly a dissection of their lymph nodes, and they would have been in for 2-3 weeks. They would have chatted to the bloke next door in the bed. Their families would have met in the car park. They would have had all that support. We don't get that anymore. We're trying to move people through the hospital. They don't generally stay in for very long, maybe a couple of days. So we looked at providing a service that from all the feedback we got from patients, just wasn't happening. So about 4 years ago, we started the Living Well sessions. These Living Well sessions are education and information sessions or mornings for patients and their families to kind of take back some control. We often find the same questions are coming up over and over again. So as nurses, we then organise the Living Well sessions, which tend to last about 4 or 5 hours. I know some of the people here have been about 5 hours, something like that. And we always offer tea and coffee in between times. And again, it's a good opportunity for peer-to-peer support. So it's a good opportunity for patients and their families to have a chat before, during and afterwards. And we're lucky enough to have a new hospital here in Bristol opened a couple of years ago. So the events are now held in the hospital. So all our patients get free parking. They're generally, as long as they can find a parking space, they all get invited. And we have a lovely room with a big view of Bristol, and it's all very nice. And I'll just look at the things that we cover in the education sessions. So again, a lot of this is on the website. If you look on the Macmillan website, this is for health professionals and for patients. These are sort of the information that you can download or request in either online formats or as booklets or CDs or videos. So it's all there, all the information resources. So what do we look at in our Living Well mornings? We run these mornings 4 times a year, and we have generally the same speakers. We're lucky enough to have the same speakers that come along to talk to patients every session. So we have a question and answer session. So for you, anyone that here that saw Ewan Wilson earlier this afternoon, he's one of our plastic surgeons. He started off by doing a question and answer session about melanoma to our patients in the hospital. We started off by doing it for about 30 minutes. We've now expanded so he talks for an hour, or he doesn't talk, but he kind of answers questions about melanoma treatments, what's the latest things that are available. We get a physiotherapy team to come in to look at exercise. So again, we heard earlier about the importance of exercise in both looking at preventing or reducing the risk of having melanoma recurrence, but also reducing the risk of having new, different kinds of cancers. So we have a physiotherapy team that comes in. We have an exercise programme that's available across Bristol and South Gloss and North Somerset that patients can access for a limited amount of money. We get a dietitian coming along, again, looking about the impact of dietary, sort of healthy diet and supplements. So she talks all about healthy eating, and we give out patient packs, a bit like you've got on the chairs today. We give out packs to the patients that come along about diet. And we also have a very lovely new Macmillan information centre. So we have one of the team that comes over from there and talks to the patients about support generally, so returning to work, looking at finances, travel insurance, life insurance, benefits, looking at voluntary services. So again, that's all available to all of our patients here. And we also then have a talk from one of our psychology team about the emotional responses. So again, you heard earlier from Dr. Kelly about the emotional responses. You know, I can't predict as a nurse how anyone's going to react to their diagnosis, either when I see them or long term. But we have a psychologist that comes along that can offer one-to-one counselling with individual patients. But we also are very lucky to be able to offer not only the Living Well morning, but a Living Well course. So as a spin-off from the Living Well morning, we offer again 4 times a year in Bristol a self-management course that's run by a psychologist, plus myself or one of my nurse colleagues, plus patients who've gone through the experience who've now come back to help us run these groups. And these groups will run for about 2.5 hours once a week for about 5 weeks. We get groups of patients together. It's all voluntary, but we tend to get between about 6 and 12 patients come together, and then we look at lots of aspects in more detail, such as managing fatigue, self-examination, stress management, combating depressive reactions, and then signposting. And again, we can't predict who's going to need these courses. Generally, once we get people onto the course, they'll all say, oh, it's amazing, I'm really glad I came, I've learnt so much, I've now gone home and I've talked to my family, I'm doing more exercise, I'm adapting things in my general life, I'm able to talk to people. So it's not just the individual patient that benefits, it's kind of a much wider audience. And we were talking earlier about, you know, whether actually coming along to these courses will, prevent patients bouncing backwards and forwards between us and the GP, whether it reduce the amount of antidepressive tablets people want to take. We've been running the courses for probably about 3 years. So we've seen, 100 patients plus have gone through these courses now here in Bristol. So kind of looking at how does it help long term? Patients, how does it help patients long term? Better knowledge of signs and symptoms of recurrence and consequences of treatment. They hopefully can be more confident to, again, like you guys here, to question and to challenge information and make really good informed decisions. And hopefully they have reassurances when they've come to our Living Well courses and days and heard what we've got to offer about services and treatments that are available not only locally but nationally across England as well. And in terms of the hospital, how do we benefit? Well, actually, a lot of the things that we talk about in these big sessions, as nurses, we would end up saying the same thing over and over again to every single patient in each appointment. And actually, if we can get everybody together, much better use of our time. We can get more speakers available. We can, cover it all in one topic. We can share concerns and go into lots more detail in one session. So for us, it's much, much better to do it all in one go. When I started, we had 250 patients with melanoma 15 years ago. We now have up to about 500 patients with melanoma. They all get invited to these Living Well days, and they all get invited to the Living Well courses. We're trying desperately to make it not mandatory, but we would love everybody to come. We would love everybody to come, but we know actually they don't. What else do we offer? So as well as having the sessions, the big group sessions, we also offer one-to-one. So again, we can't force people to do anything, but most patients we try and capture in their families, and they would have at least an hour post treatment. Normally we see them once they've had their initial diagnosis and they've had their treatment, whether it's wider excision or lymph node dissection. They will have a 1-to-1 hour-long session with one of the nurse specialists. We go through in more detail, individual to them, tailoring what this means to them, what they can do, how do they self-examine, what do they need to do, how can they access free therapies, complementary therapies, dietary advice, physio, exercise courses. So they all have that as well. At least we get offered them. We pull from quite a large catchment area. So though we're in Bristol, we see people from an hour and a half away potentially. So not everybody wants to come backwards and forwards. And again, it's perceived as, you know, I will come along. Potentially, some patients will say, I'll come along to my checkup appointments with the doctor or with the nurse, but I don't want this other complementary therapies. But you know, we offer it to everybody, and we love everyone to come, but not everybody does. So kind of looking ahead to what we'd like to do here in Bristol. So we'd like to increase the attendance of the Living Well events. So say we invite 500 people a year to one of these Living Well training sessions, education sessions, whatever you want to call them. Only 25% of people come. So how do we increase that? We've tried tweaking the letters that we send out. So we've tried making them look really important on paper and branding it with hospital logo to say this is going to be your next appointment, but only 25% of patients will come along to one of these Living Well events. So again, a bit like you guys here, they've selected to come in. And then moving further away, looking at potentially stratified follow-up. So we looked earlier about follow-up, and we know the follow-up plan differs, certainly in different countries across the world. In terms of follow-up, the NICE guidelines that were published last year recommended follow-up for 1, 3, 5, 10 years, potentially, depending on what type of melanoma you had. But can we look at having a more tailored approach? So, for example, some patients who've had, not melanoma, but who've had breast cancer or bowel cancer, may be discharged after their treatment and then would just call in if they've got a problem. You know, can we look at tailoring follow-up so we don't have to see everybody routinely? If we teach people properly what to do, what to look out for, if we have easy access back into the system, patients often worry that if they get discharged from the hospital that they'd never be able to get back in again, or if they do need to come back and see us again, that it takes weeks and weeks. Actually, can we look around at changing that? You know, have we got a really motivated group of patients that know what to look out for, to self-examine, that know what to do, that know how to call in? So can we look potentially about changing follow-up? Can we look at self-management? So can we potentially discharge patients? Again, a well-motivated group who know what they're doing. Can we look at potentially anybody with a melanoma less than 1 millimetre? Can we discharge them after they've had their operation straight away? Do we need to follow them up for a year? I don't know, it's very controversial, but I guess that's what we're looking at. And that's it. More information about the recovery package and kind of rolling out across the UK is available on the Macmillan website. Anybody would like to have a look at that? And I'll be welcome questions later if anyone wants me to ask. Answer any. Thank you.